Let me introduce myself to you. This is who I am. No more, no less. God bless us, everyone. We were broken people living under loaded gun. Where oceans bleed into the sky. God save us, everyone. Will we burn inside the fires of 1,000 suns?
Our role is to go out and make a difference, and to be a difference, and to serve in our communities, rather than saying, what can the community do for us, or how can the community come in and make our churches bigger. We want to give out.
Everyone will be burned inside the fires of 1,000 suns. For the sins of all, the sins of our tongue, the sins of our father, the sins of our young. And when I close my eyes tonight to sin.
Behavioral health is essential to health. Treatment works, people recover, and the prevention also works.
Memories in cold at night, where oceans bleed into the sky.
Welcome to Seeing the Need, Finding the Solution. We're talking about Mental Health 2013, focusing on mental health first aid in Arizona and a whole lot of other topics that fall underneath the umbrella of mental health, specifically for people who suffer from a mental illness or co-occurring disorder as well. As you know, the last show, if you had a chance to catch it, which was a dynamite show with Crisis Response Network, Ms. Suzanne Rabideau, Teros, Dr. Manuel Medina, and is also La Frontera Impact Suicide Prevention. What we wanted to do with this campaign is partner with a number of provider network organizations, agencies, regional behavioral health authorities, state officials, and make this a statewide campaign to try to implement the aspect of mental illness or mental health first aid in areas that don't get that education and training, with a lot of goals behind that. And today we have some special guests with us from Cenpatico, which is a regional behavioral health authority, has a huge scope of services and responsibility in the valley as well. We have Sheina Yellowhair, which is tribal liaison for Cenpatico. Welcome.
Thank you.
And we also have Ashley. Ashley Powell, you are and I always get this right, what is LMSW, number one?
Licensed Master of Social Work.
And DBH is?
Doctor of Behavioral Health.
So she's got like a whole bunch of degrees. Okay? So with that in mind, you've been with Cenpatico for about 5 years.
Right.
So tell us a little bit about Cenpatico.
Cenpatico has been the REBA for 4 counties in Arizona since 2005, and then we've acquired another 4 counties in 2010. So we are the Regional Behavioral Health Authority for those counties, and we manage the behavioral health and substance abuse services for Medicaid eligible persons in those counties.
Now for the person that comes in from, say, Toronto or Idaho to Arizona and doesn't know what we're talking about, is just here on vacation, what is Medicaid services?
Services for low-income populations.
For the what?
Low-income populations.
Okay, so you service people that are really in a place where they need help. They don't have money for insurance and they need services in that area. So it's behavioral health services, services for people who suffer from a mental illness across the kind of board. 8 counties is it total?
Yes.
8 counties, wow. That's a large area.
Very large.
So how, if you looked at Arizona, how far is that scope reach? I mean, reference demographically.
It is pretty much the southern half of Arizona minus Maricopa and Pima County.
Wow, it's a lot of area.
Yeah.
So your job as a tribal liaison is to what?
to work with the tribes in our areas and our service areas to ensure that they're aware of what services are available through our service providers, and to know that they know how to navigate the system so that their tribal members can access our services.
You know, one of the biggest roadblocks and challenges I know from a personal experience from recovery is trying to figure out what is available out there. And I didn't know until I actually got into the mix of recovery to find out inside those walls, little by little. And still to this day, in the capacity that I serve in the system, I learn stuff new every day. Cenpatico has about 62 pages that I looked up on their website of agencies that you guys associate with. That's a lot of companies that you guys are responsible for helping fund and carry those services and deliver them out to the community as well. With that in mind, why Cenpatico wants to focus on health and wellness through medical integration. Ashley, when you're talking about medical integration, your title was a program specialist for medical integration.
Correct.
Explain what that is.
Well, what we want to do is work with our behavioral health providers and have them either collaborate really closely with medical providers or actually start providing medical services within their behavioral health clinics to start improving the health outcomes for our members. Because what they found out within about the last 10 years is that people with serious mental illness are dying on average about 25 years earlier than the general population. And in Arizona, that number is actually higher. It's about 32 years. And so what they've also found out through research is that if you can coordinate care and practice medical integration by having people focus on nutrition and having people focus on wellness through physical activity, you can improve those health outcomes. You can have people that have, say, depression and diabetes or schizophrenia and heart disease. By having the medical doctors and behavioral health providers working together and really coordinating that care, you can improve those health outcomes and help people live healthier and happier lives.
We're going to show you a video come up here in just a second. And what Ashley's talking about is the fact of integrated healthcare. And what that means is, you know, historically, mental health services were provided here, nutrition over here, physical over here, and what a lot of agencies are trying to do, and what Cenpatico is doing, or has done, is try to integrate those all together so the whole person can be treated all in one area. Go ahead and take a look at this video, and we'll show you a little bit about Cenpatico.
Good job. That was exhausting. I really can see some mentorship happening, some connections being made, like a teenager playing a board game with a 6-year-old. Kids who maybe were looking for a big brother, big sister, and now they have a place where they could go and find that relationship and be in a safe environment and have it be fun.
Pretty fun thing, at least. Yeah. What do you think?
Amazing. That was
really, Melinda, this is phase 1. This is just the beginning of where we expect to take this entire campus.
the part of my job that I love the most is that I get to work with people to find solutions. I get to sit down and talk about what does this particular community need, and then how can we as community partners make it happen. Cenpatico will be working with Betty to make her vision happen. We will help her accomplish what she needs to improve the lives of the people in San Manuel.
So that's a little bit of what goes on with Cenpatico. What I want to talk about, and this is for either or, so either one of you can kind of chime in at the same time or differently. When you talk about integrated healthcare and SMI, for those of you who don't know what that is, it's a designation. It's called seriously mentally ill or serious mental illness. When we're dealing with that and comorbid conditions, how does that improve the health outcomes? I mean, what is some of the things that improve that for that population?
Through medical integration, like you said a minute ago, what has happened historically is that behavioral health services happen in one place and medical services happen in another. And a lot of times, those two places did not talk to one another. So if someone had schizophrenia, their behavioral health providers might not really be aware that they had diabetes, or their medical providers might not really be too aware about what was going on with their mental illness. And when you're treating the whole person, you can really make sure that all of those things are being taken care of at the same time. So when you're looking at the heart disease or you're looking at someone's schizophrenia, you can make sure to address all of those things and make sure to take care of them together in a treatment plan to help reduce the the impact of things that cause heart disease like obesity and all of those things to help improve the health outcomes.
And is it Sheina, how difficult is that integrating that with the tribal and the native reservations where you know, maybe coming in as an outsider or establishing even new clinics? I know you guys have a great reinvestment type of aspect that you guys give back to the community as well, but how is it received well? Is it a challenge being able to mix everything with that? What is your experience?
I think the key to our working collaboratively with the tribes is to establish letters of agreement with the tribes, and we've gotten authorization from the tribal councils to work with their tribes and with their departments, and to really build those relationships with our tribes so that we can work on those types of projects. But tribes vary greatly from area to area. So some may have an Indian Health Service clinic already in place. They may have their own tribal behavioral health clinics in place. So really it's assessing what is currently there in the community and supplementing those services, and rather than replacing them. So that's what we do with each of the areas that we are in.
So outreach must be very big in your area, especially in that aspect. So do you have outreach teams that are either agency related or REBA or Regional Behavioral Health Authority? How does that work with your outreach?
We do. In Cenpatico, we have a whole outreach team that works within the community. They are our community connection specialist, and they work in each of our areas. And then there's me that works with specifically with the tribes.
We talked a little earlier on another show with Dr. Medina, and obviously linguistic aspects of being able to relate to clients and people and that suffer from anything, to be honest with you. But how is the language barrier in geographical areas, how does that play a role in your services that you deliver?
A lot of our areas are very rural, including the tribal reservations. And a lot of the population in those tribes are older folks who may only speak the language of their tribes. And how we've overcome that is that we've established a support line called the Tribal Warm Line that utilizes persons, we've employed persons that are members of those communities and speak the language to be on that line and offer support, over the phone support for any tribal members that are, you know, needing support and wanting to speak in their own language.
As kick back to Ashley, I always try to get a question that's not on the sheet as well. I used to work in the field, and I always love to know what the heartstrings are, the people behind that do stuff. For you, if you had one message, and I'm going to tell you to look at that camera here in a second, that you would tell anybody watching, if you had one wish to tell them or one thing you would love to have them know, what would it be to the person who still suffers out there? That is the type of clientele that you serve.
Okay. It would just be that you can get help, and there are people out there that really want to make things better. And as far as receiving medically integrated services, the idea is, like I've said before, is to treat the whole person. So if you've gone to places before where you don't really feel like someone understands you, or you're not really getting the services that you need through this new type of treatment, this new concept of treatment, I should say, hopefully that can change and you can get the help that you need.
And Sheina, for the person that is of Native American descent, that is sitting there on a reservation or hasn't made the phone call yet, doesn't know what's out there, real quickly, what would you tell them?
I would say that don't be afraid to get the help that you need, that we are here to help you, and we have set up different avenues and mechanisms for you to access services and to help you understand services, and the help is there for you. Just don't be afraid to pick up the phone or go into that office, regardless of what community members may think or others may think. Just go and get the help.
It's Cenpaticoaz.com. The information up on your screen. Again, Cenpaticoaz.com, 866-495-6738. If you need an assistance for yourself or a friend, please log on to that, get some information, or make the phone call. We'll be back after this break with some new guests. Thanks.
Introduce myself to you. This is
There's no stigma or discrimination against the heart, the liver, the kidney, even the gallbladder. Doesn't even have a job.
Yesterday, depression was kept in the dark,
And bipolar disorder was your best friend's mother's problem.
but the tide is turning.
We're stopping the stigma.
We're coming out.
Our goal is to make the discussion of mental dis-ease cool and trendy.
No kidding?
Me too. No kidding.
Me too. No kidding.
Me too.
It's time we gave the all-American brain some peace of mind.
Native American Connections has been building healthy communities throughout Arizona for nearly 40 years. Our first-class services are designed to help people by improving the quality of their lives. Whether the challenge is substance abuse, mental health, or housing issues, Native American Connections cares. We are here to help. Everyone needs an affordable, safe place to live. Remember us when you are seeking housing opportunities that support your needs. Visit our website at nativeconnections.org, your partner in building healthy communities.
I'm not afraid.
Yeah. It's been a ride. I guess I had to go to that place to get to this one. Now some of you might still be in that place. If you're trying to get out, just follow me.
Hi, welcome back to Seeing the Need, Finding the Solution. I'm Phil McIlveen. We're talking about mental health 2013, a need for mental health first aid in the state of Arizona. And we want to be able to take that into all areas of Arizona and be able to educate, identify, connect people with resources, and support them along the way. We have some special guests here today who have not been on the show. And I want to introduce you to Maria Elena Ochoa. Welcome, Maria.
Mucho gusto.
Mucho gusto to you. Don't know what that means, but I'll ask you later. Just kidding. It's very nice. We also have Jennifer. I'm going to let you pronounce your name.
Siozos.
Siozos. And we also have Shawn Mitchell. Welcome, both of you.
Thank you.
They are with Mountain Health and Wellness Clinic, or is it just Mountain Health and Wellness?
Mountain Health and Wellness.
Okay. They are also part of the Cenpatico Regional Behavioral Health Authority as well. And it's a privilege to have a group of organizations coming into this campaign from not just Maricopa County. I am really, really delighted to having people coming in from all over, but especially in these rural areas where you guys deliver services to not the normal part of the concrete, as I call it, of Phoenix, Arizona. Ms. Ochoa, would you tell us a little bit about Mountain Health and Wellness?
We've been doing behavioral health for just about 30 years. We used to be Superstition Mountain Mental Health Center, so for those folks who knew us under that name, recently we switched over to Mountain Health and Wellness because we also now provide as well as primary care services within our organization. So that's what we do.
So taking on that integrated health approach, mixing in the physical health with the mental health as well.
Yes.
You know, it's amazing. I heard it for the first time about a year ago, and I've been in the behavioral health field beyond all this TV stuff way before this. But the phrase that I love the most is we all have physical health, which means we all have mental health. And so many people separate themselves from people who suffer from a mental illness, which always amazes me now when physical health, you look at somebody that may have a broken leg or may have something wrong with their arm, but they still look at them like a person. But for mental health, soon as somebody is suffering from an illness from that, that stigma just gets in there and it kind of separates from them. Within the services that you provide for the integrated health aspect, so you have the primary care services mixed with the behavioral health aspect. Is there outreach? Are you guys more inpatient? How is that directed within your facility? Meaning the services that you provide. So behavioral health services, do they have groups? Do they have outreach? What kind of stuff goes on over where you're at?
We are an outpatient facility, and we also have 2 psychiatric subacute inpatient facilities in which we can provide psychiatric stabilization as well as detoxification for substance use.
Now, is that 24-hour or is it certain?
Yes, it is 24 hours staffed with nurses, doctors, and behavioral health technicians.
So I'm going to take a guess here, since I know you guys are out in rural areas. It's 24 hours urgent type of care services for psychiatric.
Right, that's 2 of our hospitals, but we also have a large presence in the outpatient setting. We have several outpatient clinics throughout Pinal and Yuma County.
How big of a demographic area do you guys serve? That's got to be huge.
Absolutely. We consider ourselves a statewide provider because we do provide services throughout Yuma County. Then we also provide services throughout all of Pinal County, and we're into Maricopa County, the eastern part of Maricopa County, and then out through Queen Creek area.
So is that as close as Apache Junction would be, or?
Absolutely. Our main office is in Apache Junction. Our largest facility is in Apache Junction.
Wow, oh my God. Shawn, I was just talking with one of the Crisis Response Network CEOs a little bit ago, and we was talking about 350,000 calls they get a year on that. Servicing that big of a demographic with what you do, I was reading your bio and some different stuff that you had put down, but one thing that I really liked what you put down there was about the teaching aspect and being a teacher. What has been the biggest blessing for you working with this agency?
I guess it would be setting an example and a role model, and just being able to come in and provide services to people who haven't had these services previously. Since we're in the rural area, we do reach a lot of people who otherwise wouldn't be able to receive services. A lot of these folks just haven't had attention paid to them other than, negative attention. So they just really brighten up when, you show an interest, you validate their concerns, and, you just kind of keep them in bounds as they go through different life skills and just the learning process on coping with their...
You're a job coach with them as well?
Yes, that's correct.
Barriers that go along with that, meaning challenges to overcome, and for people with behavioral health issues as well as mental health issues. Getting a license, something as simple as that, or transportation to groups, or medication, or even support. What an amazing area. A lot of people I know that don't look outside the area of Phoenix, and you look at the state of Arizona, and it's, to me, it's all got the brown around it, except for, the Prescott area and Sedona and that type of thing. But with the type of demographic that you serve, that seems to be a huge part of that crisis. I know treatment services, like here they have PRC West and different stuff like that, but I didn't even know you existed. So I can imagine what the person out there that still suffers doesn't know that you exist out there. Maria, Elena, you have been there, you've been actually 28 years in the industry, correct?
In the field, huh?
In the field. And how long have you been with Mountain Health and Wellness?
Just about 2.5 years.
2.5 years.
Mm-hmm.
What have you seen change? That's the first question I'm going to ask you. Between way back then and now?
Oh my goodness.
The most impactful thing would be?
I would say it's the topic of the day, integrating the services so that people can come to a place that they can call their health home. They can come and get their behavioral health needs met, they can get their primary care needs met, they can participate in wellness activities like yoga and Tai Chi, line dancing, nutrition classes. At the same time, the doc might prescribe something for them, and just across the lobby there is our pharmacist and our pharmacy.
Explain the circle with the stones.
Oh, the labyrinth.
Yeah, we just popped it on on the screen while you were talking. So.
Okay, so we also have, and we're very proud of this, the Earth Heart Park and Community Garden. And we want it to be an opportunity for people to be able to get out there and move. We want the community to be involved as a part of it as well. So part of it is we have a labyrinth, and the Girl Scouts, the local Girl Scout troop, helped us to put together that labyrinth. And we have raised gardens so that we have members of the community, we have people served that are participants in growing things in those raised gardens. We have outdoor cooking there, so that what they grow in those gardens, maybe they can learn how to cook those things in the garden. We also have an amphitheater, so that if there are classes that can be taught or entertainment that provides a learning opportunity, we can do that in the Earth Heart Park and Community Garden. What you're looking at there is one of the rooms that, are the waiting rooms, especially for youth and children. We have murals that make the place more child-friendly, and there are toys, and you can see there that we have the pharmacy there that's available for folks. so they won't have to go somewhere else. They won't have to wait for their medications.
Now, your services treat age group from what age to what age?
Lifespan.
Lifespan. Jennifer, the Chief of Clinical Operations and Interim CEO, correct? This is the hardest question I always ask CEOs, and I always do this on purpose, so just so you guys know. For you, CEO aside, clinical, administrative stuff aside, why do you do what you do?
What we do, I think, is very rewarding. I got into this field, I think, by my own life purpose. I had initially got into the field to do physician's assistant medical work. And as I started going through my schooling, I got very interested in community volunteering, being involved with children's hospitals, and my life path really started to go towards the social work, counseling side of the field. And as time went on, I got interested in helping to fill the needs that are out there, which is what led me up through administration and clinical supervision. But I really enjoy being a part of a community and making change happen.
Shawn, I've got about 30 seconds. If you look at the camera and tell the person out there that is still suffering, what would you tell them?
I would tell them that it's a lifelong process, that there are some discouragements, but in the end, there is a whole community out there to help you. It's amazing when that person picks up the phone or makes the visit. Sometimes it's like the whole world just stops and says, what can we do to help? But to get that help, it always starts with the first step. There's a lot of qualified people out there to help. We're culturally competent, so no matter what culture you're from, we have help available in your language and your preference.
And Maria, for you, real quick, if you could tell, with all the years' experience you have, that's got to be a lot of heartfelt moments that you've seen over the years and being able to serve within the scope of services. What would you tell, the family out there that has not yet known that there are services that are in your area? What would you tell them? I mean, close to your heart, what would you want to express to them from your experience? Real quick.
Well, to piggyback on what Shawn said, there are services out there. Regardless of your circumstances, regardless of the condition that you're in, regardless of your level of ability, I don't like to say disability, we can all be contributing members of our community, and with some help, we can really make our community a better place and be a part of it, and that's really what drives me.
This is Mountain Health and Wellness. This is Maria Elena Ochoa. This is Jennifer Siozos. This is Shawn Mitchell. Information is on the screen as well. Please log on to the website, make a phone call, get a hold of Cenpatico AZ as well. My name is Phil McIlveen. Enjoy your Sunday evening. Remember, look for crisis, call the number. It's statewide on the screen. Be a blessing to somebody. See you next Sunday.
I see you, I know you're there, and I can feel you. I will not fear, I will trust in you, and I will not be afraid. When the battle